here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. So we need to get up more, so maybe we should have standing desks as opposed to sitting?
Well, some companies have that, obviously. I think Google, Apple may have
a lot of them do.
Yeah, absolutely. I mean, I think the research is there, the data is there, and we've known about this for a while also. It's just difficult for people to get up and do that. I don't think anyone locally is doing that, but you don't necessarily have to walk the whole time you're at work. I think just getting up routinely, maybe about every 45 minutes to an hour, will help with that situation. Prolonged sitting is not good for you. Metabolically, chemically, something negative happens to a person's body when they're sitting there for a prolonged period of time. Not to include risk of blood clots, certainly when you sit for a long period of time. We talk about that a lot with plane trips, car trips, but certainly that's what this segment indicates, is that physical activity is good for you. If we could put that in a pill and sell that, I wouldn't have a job.
You'd be rich.
Yeah, I wouldn't have a job, basically, just because physical activity is just so good for you, which is why we preach and talk about it all the time. It doesn't have to be high intensity. Sometimes high intensity can cause injuries to a person, so it's mainly moderate intensity exercising at least 5 times a week that really helps. So just try to be as physically active as possible.
Okay, on to some of our viewers' medical questions. This person wants to know, how do you get a ringworm?
Ringworm is basically a fungal infection. Certainly viruses, bacteria, they're ubiquitous in the environment, and sometimes we can get infected with those. The immune system is not perfect every single day. Certainly the more medical problems you have, the more at risk you are to have those sorts of infections, ringworm that is. Certainly we have topical medicines, tablets that can be treated with antifungal medications. It's normally not a serious condition unless you're on immunosuppressants. Sometimes the fungus can get in your bloodstream and cause serious infection, which we call sepsis, but for most of us, it's very easily treated with topical medicine.
And does it have to be prescribed to you, or is it something over the counter?
You can try something like Lotrazone over the counter initially, but obviously if that doesn't work, we have some prescription medications that are very good.
Okay, another question. I'm having a hysterectomy in 2 weeks. I'm 32. Also a PCOS patient. Did I make the right decision? I'm hearing my PCOS symptoms will get worse.
Polycystic ovarian syndrome, certainly talk with a gynecologist or obstetrician who's performing the surgery. Normally the risks and benefits are explained to the person. If there is an issue, that surgery is the best option. That's normally when it's offered. So I'm assuming that this person has a surgical indication to remove her uterus. That's not necessarily related to PCOS. PCOS is an endocrinological problem that has to do with sometimes obesity, predisposition to diabetes. So hysterectomy doesn't cure PCOS. That's a totally separate issue.
All right. This person wants to know, are B12 injections safe?
Yeah, absolutely. We actually give them in the office, and certainly we can write a prescription for patients who have true B12 deficiency, and they can give it themselves. It's like giving an insulin injection, so yeah, absolutely.
This person suffers from pain every day, all day long. Pain exhausts them. How can they get a good night's sleep?
It's tough. You know, chronic pain is very miserable existence and is very difficult to treat for some patients. Certainly they might require different regimens to control their pain, not necessarily cure their pain. I think everyone is looking for a cure. And I think the doctors are trying to do that as well, but some people just get into an issue with chronic pain. A lot of times you need antidepressants, sleeping medicines, even strong narcotics. Certainly work with a qualified healthcare professional to work with chronic pain. Sometimes you can go down a slippery slope and get in trouble with chronic pain. Certainly don't do that and just work with a good healthcare professional.
A 68-year-old female, for the past month, she's not had a natural bowel movement. She keeps having to take laxatives. What could be causing this?
Constipation, very common in this country because a lot of times of our lifestyle, we talk about exercise, being sedentary, sitting a lot is one of those side effects of sitting a lot. And a lot of times we get constipation, we eat a lot of processed food with no fiber, we don't drink as much water as we need to. That's just the tip of the iceberg, basically. Medicines, thyroid illnesses. Basically, we have a lot of things over the counter. Miralax powder is one that I recommend all the time. Comes in a little purple capsule. You drink about 2 or 3 times a day. It takes about 3 days to kick in. It's very soft, but it's very good. Certainly increase fiber in your diet, increase physical activity, increase hydration, and maybe check your thyroid. If you're 50 and above, get a colonoscopy. If you have weight loss, certainly.
Okay, a 62-year-old male, when you get food poisoning, does it take effect that day, or could it be from something you ate a couple of days ago?
Normally it's about 3 hours or so after you've eaten that specific thing. Certainly it's normally sudden in onset. Patients understand, oh, I just ate something bad, and it kind of tasted bad, it looked bad. So a lot of abdominal cramping, vomiting, diarrhea, fever, last about 3 to 5 days. The normal thing is it gets better on its own a lot of times. Just stay hydrated. Certainly if you have blood in your do a lot of high-grade fever or severe pain, get to your healthcare professional.
All right. 67-year-old female, arthritis in the left knee. She will eventually have to have a knee replacement, but she's walking good to ease the pain until then. Is that all right?
It's perfectly fine. Actually, the orthopedists want you to wait as long as possible. It's man-made, which means it can wear out. You don't want 2 knee replacements, so you want to wait as long as possible. Weight loss, good physical activity, eating a clean diet, certainly other things you can do to reduce pain and inflammation. And if you're smoking, certainly get off the cigarettes.
Is there a time where they say, no, you're too old for knee replacement?
Absolutely they do, but certainly that age is getting higher and higher as anesthesia is getting better, the techniques are getting better. We're getting better at controlling a lot of these chronic illnesses, so there is a cutoff, absolutely.
All right, Dr. Levine, as always, we appreciate
Yes,
you
ma'am.
stopping by, and you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen, fax us 892-7305, or email us at laf@kfdm.com, or post those questions every Monday on our KFDM News Facebook page.